Now we know that return to activity, it's about involving the patient and their family into a gradual return to a number of different things.
I like to see the individual early in the process to provide education and information about how this process will proceed, and then ask them to call me periodically to provide me updates on how they're doing.
When is it appropriate for these individuals and these patients to be returning to school? When is it going to be appropriate for them to return to play?
You may choose to return a patient to their academic setting while they still have some low-level symptoms, but that doesn't mean that they're ready yet to go back to return to play.
It's important to talk about re-engaging school and school attendance even while some symptoms are still present.
There's some general guidelines, like being able to pay attention and focus for 30 minutes is a good starting place. But if the school can be accommodating and allow them to take breaks or lay down in the nurse's station, they may be able to go back sooner.
Many students aren't able to tolerate a full day of school early on and will often need breaks during the day. They may need a shortened school day or the opportunity to be in a quieter environment, controlled passing periods, staying out of the cafeteria. Once we can get through a full school day and back to normal baseline, then we can begin progressing on the athletic field.
Because we typically assume that they are completely symptom-free before any return to play aspects are incorporated into that progressive return to full activities.
And we begin with increasing aerobic activity, increasing resistance, doing some non-contact sport-specific activity before engaging in contact.
I also like to see them again before returning them to any sort of contact activity to make sure that we thoroughly assess those cognitive symptoms as well as any aspects of dizziness or other symptoms that may not be resolved.
And a lot of that will come down to the preference and the experience that the licensed healthcare professional has in dealing with concussions.